All right, hello. It is the 5th of June, 2019, and this is our Zoom call for today. We're going to touch on some questions that came in. Remember, if you're new to our clinic, it's very difficult. You're not going to get answers to emails if you email us questions. If you email us questions, they're for the Zoom call. If you have an emergency, make sure you call the clinic. Um, I literally get over 200 emails a day. So please, on the email question that you want for the Zoom call, put in the little part of the email where it says topic or whatever it is, subject, that's what it is. Put Zoom question so I make sure I catch it when I search for it to get ready for a Zoom call. We had questions about Herxheimer reactions. Now, what a Herxheimer reaction is typically describing somebody going through biotoxin illness, like they're killing off mold or they're killing off Lyme or co-infections. But really, a Herxheimer reaction is when you react to endotoxins. So endotoxins are, when you talk about bacteria, if I kill Lyme bacteria in my body, it is the particles of the bacteria that now are circulating in the blood. Let's say you blew them up with your immune system. Well, your body doesn't reabsorb those and reutilize those like it does when it kills your own cells. When it kills bacteria and things, the particles from that bacteria are called endotoxins. Endotoxins can be reactive to your immune system in themselves. Gram-negative bacteria like Lyme disease also have lipopolysaccharides in the cell membranes, and they can react to your immune system and you can feel sick afterwards. Also, when you're killing cancer cells, you can have Herxheimer reactions because if you kill through apoptosis, apoptosis is a recycling of cell matter. So normal programmed cell death, aka apoptosis, you don't ever get a Herxheimer reaction. You don't liberate any endotoxins because it's recycling that matter. But when you kill through lysis, like doing chemotherapy, you will get Herxheimer type reactions because you kill through a different pathway. Lysis is the cell basically exploding because of a poison. So it's going through a totally different death cycle because of toxin. That's what chemotherapy is. And that lysis will break apart cell matter and you will get endotoxins there, and you can get reactions and immune reactions to those endotoxins as well. So cancer patients can get Herxheimer's reactions as well. So those are typically called Herx reactions. And that's what can happen when you do chemotherapy. That's what can happen when you're killing Lyme disease. Herxheimer reactions are not pleasant, and the problem is that you can't completely control them. Everybody reacts differently, just like somebody going through chemotherapy, they just quote unquote sail through, never have any side effects, and another person has horrible side effects even after the first chemotherapy. Same thing with Lyme. It's impossible to know how someone is going to react to everything. That's why you have to go really, really slow. So how do you deal with Herxheimer reactions? Well, there's no sure way, but the biggest thing is we have to help the detox pathways. Here's some of the symptoms that a person would get with Herxine, and they can be varied. Anything that's going to stimulate the immune system could cause a million different symptoms. So this is a list from Lauracidin, a product that we use for Lyme patients sometimes, but it can be much more explosive than this. But the biggest thing with dealing with this, you have to get endotoxins out of your body. So you have to open up detox pathways. If we haven't seen the health of your detox pathways via your genes yet, the genetic pathways, the PON1 pathways, the NAT1, NAT2 pathways, the cytochrome P450 pathways, and others, we want to support those. And that's what you see with people that either have Lyme disease and have a lot of Herx type reactions with Lyme disease, or people that don't tolerate chemotherapy well. And that's really the difference that we see with a person who cruised right through chemotherapy with no real Herx reactions and a person who did not do well with chemotherapy at all. It had to do with the health of their detox pathways genetically. If a person has a lot of NAT defects, a lot of defects in their cytochrome P450 pathway, and especially their PON1 pathway. They don't get rid of endotoxins very well. They don't get rid of chemicals very well. And therefore, they're going to have more reactions to these endotoxins. So you have to support those pathways. Supporting the liver, colon, kidneys, skin, and lungs, those are your detox pathways. So when we talk about genetics, we're talking about the liver pathways. But how else can we support the colon, kidneys, skin, and lungs? Well, coffee enemas can help with the liver, can help with the colon. So doing coffee enemas can help dump stuff from the liver, can help move things through the colon. Foot bath detoxes bypass all those five main areas of detoxification, except they're using your skin that way. Just like sauna, you're helping push things through your skin, sweating things out. That can be an excellent way to help with Herx reactions, can help with, even if you're not, all these things have to do with, whether you're having a Herx reaction or not, these all have to do with improving detoxification from everything. So you're supporting the skin detoxification pathways through sweating. You're supporting it through foot bath detoxing. Breathing techniques, getting outside, doing yoga type breathing can be really good because you're getting chemicals out your lungs. I've said this before, the fastest way to poison somebody is to inject them with a poison. The second fastest way to poison somebody is to breathe it in. Therefore, the fastest way to unpoison someone, if that is such a term, is through breathing. Your lungs exchange chemicals. Those alveolar spaces in your lungs exchange chemicals, and you can breathe out toxins as much as you can breathe them in. So getting out in the fresh air, breathing, walking, getting some air, that will help that exchange and help that exchange through the blood and get out toxins that are circulating in your blood. Epsom salt baths can be extremely helpful. Using binders like bentonite clay, zeolite type products, they can be helpful because they'll bind things in your colon, because there is a percentage of things that once your liver does its job and dumps things into the colon, if you don't have a good, fast colon intestinal transit time, and you got your food stay in your colon a little bit longer, you will reabsorb those things. So using binders, all binders do is help grab onto things and keep them in your colon so you can deposit them in the toilet. That's what binders are doing. So that's another thing that can help with dealing with Herxheimer reactions. So keep up that, whether you think, oh, I'm not having a Herxheimer reaction. These are all good detox things. So the more things you can do to help take pressure off your liver, to help get things out of your body, the better off you're going to be. So think of it that way, whether you feel like you're having a detox reaction or not. The other questions that came in this week were, again, talking about pain. We addressed this on a Zoom call a few weeks back, but I think it needs to be addressed again because more questions came through with this. Obviously, the pain medications that are out there work better than any natural thing that you can have. You can take curcumin and things like that I'm going to recommend here, boswellia and quercetin and betalains and bromelain and things like that. Nothing is going to work as quick as this. The problem with taking medications for pain is, guess what? They go back and they cause these things because you have to detoxify this stuff. This chemical, once it might block the COX-2 pathway and block the pain pathway, now it has to be detoxified out of the body, and it's got to go through these pathways again. And so this pain medication is a major cause of blocked pathways. So, and it's a major cause of injury to the liver. It's a major cause of backup and clogging of the liver. And that's what is another piece. You talk about, why do people have these Herx reactions? Why do they get these things? Well, I mentioned because of those defects on those genes on the detox pathways. But another major reason, maybe the most common thing, is abuse of their liver over the years. And you could say, oh, I've never taken medication. Many prescription medication, over-the-counter medication, over the years damages your liver, even if you've never taken medication. I'm a person that my parents never brought me to the doctor, never took any drugs. When I was a kid, we went to the chiropractor. We did things naturally when I was a kid, so I feel like my liver's pretty clean. Never really drank, never did drugs, never did anything like that. But you're so exposed to everything in this environment 100 times more than our great-grandparents were. So there's so many assaults, goes way beyond this on our liver, that cause my liver to be sluggish, and then slows down my whole pathways, makes me a very slow detoxifier, and I end up having problems. So here's some natural helps too. Curcumin, these are detox pathway helps, but these are pain helps, and these are natural anti-inflammatories. White willow bark, quercetin, boswellia, betalains. We talked about betalains. That is an enzyme from beets that is very good for inflammation. Bromelain, rosemary, CBD, THC are probably our most powerful and fast-acting pain relievers that we have from a natural perspective. And ginger. We use the product Clear Inflam that has a lot of these different things in. But the CBD and the THC are probably our most fast-acting pain relievers that we have at our disposal from a natural perspective. So this is the best CBD that I think is on the market right now. This is a really strong CBD. This is a paste. It comes in a tube that's a paste. I've used this before with a lot of success. I've also used this with a lot of success too. So both of these are really good products. This one has an immune booster in it too. Okay, I'm going to unmute everybody. We've got about 10 more minutes for questions. So everybody is unmuted unless you muted yourself. So feel free to jump in and ask questions.
Is the Evolve taken orally or on the pain area?
So both of these are oral products. There is another salve, CBD salve that we have. That's a topical salve. And we have so many people ordering that aren't even our patients. It's just a really, really popular product. It's called K-Salve. It's tested really well for a lot of topical cancers as well. I wasn't, with any of the CBD salves that are out there, I'm a little cautious because I don't know the concentration of CBD that's in it. But we're getting really good results with that as well. A lot of people are using it for arthritis type pain too. It's more of a clear salve, so it doesn't leave any staining. Like those who have been with us a long time have maybe used our Curcumin Cream that has worked really well for pain and really well for topical cancers that are not melanoma, like basal cell cancers. The Curcumin Cream, the negative of that is it's kind of yellow. It's very strong yellow-orange color, and it stains your clothes and your bed pillow cases and things like that. The K-Salve is a topical salve. These two are oral. This is a water-soluble oral. The Evolve Entourage is a water-soluble oral. This is a paste that you squirt out about 2-3 grains of rice size onto your finger and take it. It tastes a little ashen. Does not taste anything like the Rick Simpson oil, and it doesn't have the same negative effects as far as symptom-wise as Rick Simpson oil. It does have some CBD in it, or some THC in it, but it's a fairly small amount, so not anything that you'd really notice. And then not pictured here is the THC because we can't sell the THC. But THC for chronic pain, either taken smoked in a pipe or in a marijuana cigarette, will help with pain, or cooked in like a food or something like that, or heated and rendered and used in in like a coconut oil um, uh, application or something like that is how THC is used as far as for pain goes.
Herx reactions, are they on when you get achiness? Is it usually the whole body or certain areas of the body?
It can be either.
Okay.
So it depends on what's going on. It can be either one. So Herx reactions can range from your head feeling like it's going to explode to your joints reacting to, um, it can be literally anything.
Anything. Okay. I've got a question off topic if you'll take that.
Oh, of course.
On the Rife machine frequencies, I notice sometimes on the True Rife emails I get, they say there's an update to the frequencies. Do we need to do that, Dr. Connor?
You do if you want to use that updated program.
Okay.
So if you update the frequencies, as it says on the True Life emails, it will not change the program that I created for you.
I understand.
So you just need to be connected. You need to have your Rife computer connected to Wi-Fi. And then it's super simple. So if your Rife computer is connected to the Wi-Fi, you open up a Rife program, and up in the program itself, in the upper right-hand corner, I believe it says Update Frequencies. Click on that, and it'll say, please wait while we're updating your frequencies. It takes about 3 or 4 minutes. Boom, it's all updated.
Just on that particular program that you have open?
No, it'll update all your programs.
Oh, it'll update all the programs.
Yep, so it updates everything. So if Mike at TrueRight, came up with another program, or if, and it's people like me that send him programs, here's another program for the, when I first started with him, there was about 500 programs that we had. Now there's over 2,000 programs that we have in there. So if there's updated frequencies for a new flu, typically in winter, we'll have an updated flu program. And I just saw an email that he had something else updated. I can't remember what it was. I didn't look closely at it.
Yeah, it was the cancer, one of the cancer.
Oh, yeah.
Foot. I think one of them was a foot bath, or I can't remember.
Yeah, so it can, if you're only running the programs that we created for you, then it doesn't make any difference whether you update anything on it or not. But if you're running some of the other programs, which we recommend you do, then sure, to update your frequencies on every 3 months or so is a good idea.
When we come back again, do you update programs?
If you bring your computer with you,
yes, sir.
We will. And if your question is, will we update your program? It totally depends on how you're doing. Okay. So we have patients that, let's say, are not doing well. They're going in the wrong direction, and they'll come back for a rescan to recheck, and we'll tweak some things, and we'll change their program around. Typically, if a person's like going in the right direction, then we do not change their program.
I see. Okay. Thank you very much.
Absolutely.
Dr. Connors.
Uh-huh.
This is Donna.
Hello,
from
Donna.
Arkansas. And I have 2 questions. One is somebody told me the other day that tomatoes and other nightshades could be damaging the colon, and therefore, when I use some spectrum to try to heal, then it's counteractive. Does that make sense to you?
Yeah, it partly depends on if you have any sensitivity to nightshades.
Okay.
So nightshades can be inflammatory, um, but remember, let's take a step back. Just because something is inflammatory does not mean it's bad. Remember what I've said over and over again. You need a
Mm-hmm.
balance of inflammation and anti-inflammation. You need a balance of oxidation and antioxidation. If all you had is anti-inflammatories and antioxidants, that would not be a good thing. You wouldn't kill bacteria. You wouldn't kill cancer cells. You wouldn't, you need to be in that balance. So
Yeah.
just because, we tend to talk about, oh, we need to decrease inflammation. Well, you need sources, you need those little spikes of inflammation at different times too. So food can give you those. So it's not something to shy away from. But that being said, some people have sensitivities to different categories of foods. Nightshades is one, lectins is another, gluten is another, things like that. So those different categories need to be addressed. If a person notices, you can do it either through an elimination diet, know that, boy, I tend to feel worse when I eat nightshades. I tend to feel worse when I have vasoactive amines. So you cut those out of your diet. And it doesn't mean that you have to stay away from them forever. You might want to cycle them back in. So
Okay.
remember what we've talked about too, that, part of my belief at least is that God created us to eat in season, really. And we
Mm-hmm.
live in a world today that we could get apples, 365 days a year. And so we tend to be habitual people and habitual eaters. And I've told the story of this little girl. I had my first patient 35 years ago where she couldn't sleep more than an hour and a half at a time. She was 4 years old. The mother
Mm-hmm.
looked like she got run over by a cement truck. She was, you just got to help me. I tested her with kinesiology. She came up sensitive to vasoactive amines, which is another category of food. Tomatoes
Mm-hmm.
is really high in vasoactive amines. They were a strong Italian family, and the mother said, "Oh my gosh, we eat spaghetti sauce,
Yeah.
breakfast, lunch, and dinner." Um, Went off of that, and within just a couple of weeks, she was sleeping through the night, and their whole life changed.
Wow.
So,
That's
and
wonderful.
she was able to go back on it, but within reason and cycle it. So,
Mm-hmm.
um, that's the way it is with many foods. Now, if we do an antibody test on you, like a Cyrex antibody test, and you show up very high in antibodies in certain foods, you have to go off of those. And
Mm-hmm.
it takes a period of time for your body to get rid of those antibodies, and then you can tend to go back on those foods in moderation and not have issues. The only
Mm-hmm.
the only real exception to that is gluten, because there's been so many studies about gluten and that the gluten antibodies can last for years and years and years. Um, but other antibodies like tapioca starch or cinnamon and any other food you can think of, they tend to believe that the half-life is a matter of days with those. So being off of it for about 3 months usually will dissipate those antibodies, and you won't have reactions to those again. So
Okay. Well, I don't usually have any kind of reactions to them, but she just had mentioned it to me. The second question I have is I've been reading a book called Magnesium Miracles by Carolyn Dean. Are you familiar with her?
yes, I am.
And what do you think about her?
Oh, I think she's good. I think you only have to, the only thing I'd tell you to be cautious about is that I do think that magnesium is an important element, and it's an
Mm-hmm.
important substance because if you look at your genetic pathways, magnesium is necessary. It's a necessary cofactor for about half of them,
Yeah.
which we're talking thousands of pathways. So magnesium is an important nutrient. Does that mean we all need to be supplementing with magnesium? I don't think so. Does it mean that it would be good to supplement with magnesium at times? Yes. And go back to video that I had Dr. Halderman do. She was a medical doctor that worked with me for multiple different times over the years. She did a really nice presentation on cycling your supplements and the benefits of cycling different supplements like your minerals. Like maybe I won't take magnesium every single day, but maybe I'll take it a few times a week. Or maybe I'll take it for 5 days and I won't take it for a week, and then I'll take it for 5 more days. That is a good idea because that's kind of the way we were created to eat. You know, we eat what's available and then we don't have it for a while and we eat again. And that kind of goes with the whole thought of fasting as well. There's times that we eat and we have a lot of food, and there's times that we don't have food. And that's when autophagy happens and our body can clean out of some different things.
Yeah. Okay.
But obviously, you know, with the amount of magnesium products that we have in our store, that's a big thing for me. I take magnesium, but again, I do not take it every day. I take it probably 3 to 4 times a week. And I switch around the products too. I use magnesium malate. I use the Magtine magnesium that's in the powder form, and put it in my shake sometimes because I want that calming effect on the brain as well.
Yeah. Okay. Very good. Well, I appreciate your time there and answering my questions.
Oh, you bet. Good time for maybe one more question. All right. Well, thank you guys for being on. This was recorded and this will be up on the Facebook page for those who weren't on it and couldn't listen. And again, you have questions, make sure you email them in to me and just put in the subject bar